Hi everyone, my name is Adrienne and I'm the Education and Community Liaison at the Nanaimo Brain Injury Society, and this is our first online Understanding Brain Injury workshop with Ashleigh Wasner. Welcome, Ashleigh. We have been doing this now, Ashleigh and I, for about 2 years. And normally we run this workshop for the public every 2 months at different locations, usually at one of the libraries. But this is our first, we've been meaning to do this for a while now, but this is our first online recording of this workshop. So normally we have people here asking questions during the workshop, but we did get a few questions through email and through Facebook, so we will ask those questions at the end. But I'm going to introduce Ashleigh for those of you who don't know her. Ashleigh is a registered psychiatric nurse with training through the Brain Injury Association of America as a certified brain injury specialist. She is the Director of Care for Bill's Place Support Services and works directly with families, multidisciplinary teams, and individuals with brain injury. So welcome, Ashleigh. I will let you take away your presentation and we'll come back to these questions at the end.
Thank you very much, Adrienne. So as Adrienne said, I am a registered psychiatric nurse and I am the Director of Care at Bill's Place Support Services. I came to Bill's Place in my last year of my nursing program, and I remember getting my practicum placement and having no idea what it meant to have a brain injury. So, which is a little bit embarrassing actually to admit. So when I got to Bill's Place, I instantly loved it. Came back for my final semester and did my specialty in brain injury and just never left. It's a really neat setting. I get to work with folks in community, people that have brain injuries, have had their brain injuries for 20 plus years, people who have just had new brain injuries and are coming to us straight from the hospital. So I'm very fortunate to work with people in all different places in their recovery. So the first slide here, if I can get it to work. Oh, maybe I don't have control now, Adrienne. Oh, wait, hold on. Technical difficulties, shocker.
Problems with, there, did it work? There we go.
Oh, there we go, okay. So the first slide that I show has this airplane, and I would typically ask the audience why we start a presentation on brain injury with a picture of an airplane. And the answers I typically get include stuff about turbulence and how having a brain injury can be a very turbulent experience. Lots of folks think about, being in a plane crash can be a way to get a brain injury. But why we actually show this plane is that the number of seats on this plane is the equivalent to the people who sustain a brain injury daily in Canada. That number is likely grossly underestimated due to the underreporting of brain injuries. If you think about brain injuries that are sustained maybe through intimate partner violence that people don't want to report, or maybe you're macho guys who get knocked out and don't necessarily want to go to the hospital and seek help for a potential brain injury. This is a presentation on the brain, so we should probably go over the brain. I'm kind of bummed out that my shirt doesn't show, but I am wearing a really cool brain shirt. So we'll go over it really briefly. I'm not going to get too in-depth on the neuroanatomy part. The brain is divided into two hemispheres, the right and the left hemisphere. A neat fact about that is when somebody has a stroke and it's in their right hemisphere, it's actually the left side of their body that is impacted, and vice versa. If the stroke occurs in the left hemisphere of the brain, it's the right side of the body that's impacted. Right at the bottom, that little pink piece is your brain stem, and that controls all of your involuntary bodily functions such as breathing, heart rate, digestion. You have your yellow piece, the cerebellum, and that controls smooth, coordinated motor functions. So when you're walking nice and smoothly, the cerebellum is partially responsible for that, as well as balance. You have your occipital lobe in the back, and if you've ever smacked your head and seen stars, that is an actual phenomenon that happens due to an inappropriate firing of neurons after the occipital lobe gets stimulated from being hit. So that's where all your visual processing takes place. Again, why you see stars when your occipital lobe gets a little nudge. The orange piece there, the parietal lobe, is where a lot of your sensory processing takes place. So if you think taste, touch, temperature, that's all processed by your parietal lobe. You've got your temporal lobe, which goes kind of along where your ears are, so it makes sense that auditory processing happens here. There's also language centers in the temporal lobe, including Wernicke's area. And when somebody has damage to that area of the brain, they have what's called Wernicke's aphasia. And this is when somebody can speak fluently, but not necessarily make any sense. And if anybody has time and interest, if you actually go on YouTube and Google Wernicke's aphasia, there's a really neat clip of a gentleman there who has had a stroke and has Wernicke's aphasia. And he's speaking to his therapist, and you can see that if you mute it, it looks like he's speaking very normally, completely fluently. But if you add the sound, the actual content of his conversation doesn't make any sense. What's left? We have the frontal lobe. That's where you have your executive function. That's a big one in brain injury because the frontal lobe is quite often impacted by traumatic brain injuries. If you think about what an executive does for a company, they take in information from all the employees, they organize it, they maybe make judgment calls, make decisions, and then put in place a plan to execute. That's a lot like what our frontal lobe does for us. It takes in all the information, makes judgment calls, plans, sequence, organizes information. Oh, we also have Broca's area here, which is another language center. So kind of the opposite of Wernicke's aphasia is Broca's aphasia, where if a person has Broca's aphasia, they are able to think in clear, fluent streams of thought, but they actually can't get the words out of their mouth. Oddly enough, in my experience and the experience of a longtime SLP that I talked to, a speech language pathologist, people that have Broca's aphasia can still say highly charged emotional words like the F word. So interesting fact for you about Broca's aphasia. So we can talk now about some stats because everybody loves stats. It's just a really good way to snapshot how prevalent brain injury really is. Acquired brain injury is the leading cause of death and disability for Canadians under the age of 40. 1.5 million Canadians are living with the effects of acquired brain injury, again, probably grossly underestimated. And 465, which is the same number of seats on that plane from the first slide, people suffer from a brain injury in Canada daily, and this amounts to one person injured every 3 minutes. Males experience brain injury twice as often than females, and this we're actually seeing level out a bit more. If you think about why men might experience brain injury twice as often, kind of give some thought to maybe the riskier behaviors that men tend to take part in more frequently than women. But as I said, we are seeing them kind of become a little bit closer with women participating in higher contact sports and also riskier activities like motocross and things of that nature. So survivors of brain injury are at 3 times greater risk of experiencing a second brain injury, and they face an 8 times greater risk of sustaining subsequent other injuries as a result of their initial injury. And if you think about the consequences of brain injury, this actually makes a lot of sense. So if you have a person who sustains a brain injury that results in maybe some balance issues, they're at greater risk for a fall, which can result in a subsequent brain injury. Or say you have somebody who has a brain injury who's maybe that's impacted their insight, their judgment, maybe they're a little bit more impulsive and they're taking more risks. that again increases their risk of brain injury. So what is an acquired brain injury? An acquired brain injury refers to any damage that occurs after birth and is not related to a congenital or degenerative disease. So something like cerebral palsy, which is damage to the brain, is not considered an acquired brain injury because it occurs before or during the birthing process. Dementia, Alzheimer's, things of that nature are also not considered an acquired brain injury because they are a neurodegenerative disease and they have their own classification. Traumatic brain injury, which is primarily, well, currently most of the people that I have at Bill's Place have traumatic brain injuries, are caused by something that comes from outside of the body, so an external force such as a blow, bump, or jolt. Non-traumatic brain injuries are caused by something that happens inside of the body or a substance that is introduced in the body that damages the brain tissue. We can flesh this out a little bit more. So I think it's the acquired brain injury is kind of the umbrella term. And then we've got the offshoots of non-traumatic and traumatic brain injury. So when we're talking about non-traumatic brain injury, we're looking at things like anoxia, which is lack of oxygen to the brain, which can happen in near drownings or kind of a morbid thought, but strangulations. Infections can also cause non-traumatic brain injury, such as meningitis, strokes, tumors and the removal of tumors, and metabolic disorders are all considered non-traumatic brain injuries or can cause non-traumatic brain injuries. So when it comes to traumatic brain injury, you can see it's branched off there as well. We have an open brain injury, which means that the skull is actually fractured and the brain can be exposed. And those can come from assaults, falls, accidents, intimate partner violence, or surgery. Closed brain injuries, they have this fancy term here, internal pressure and shearing. What that essentially means is that the brain is, the axons of the brain, when it's shaken or moved around from being jolted, the axons actually stretch or shear, as well as when there is a closed brain injury, there is nowhere for the brain that is swelling due to injury to go. So that can cause damage as well. It could be from assaults, falls, accidents, and abuse. Now, sometimes during this piece, I get asked which is worse, open or closed brain injury, and they both have their own risks associated with them. An open brain injury comes with a greater risk of infection because everything's open, but closed brain injury can actually be quite concerning. Well, it's all concerning, but because when the brain swells, it has nowhere to go. And so it essentially swells and presses downward on that brain stem. And that's where all your vital functions happen. And so your heart rate, your breathing. So if that piece of the brain isn't able to function properly, then you're in big trouble. So I added this slide recently because I think it's important to point out that, the brain, even though it's protected by cerebral spinal fluid and the meninges that cover it and offer it some protection, the inside of the skull is still quite, it has a lot of ridges and it's not, you can feel it, your skull is not soft. And when you do hit your head on one side, your brain still rattles around. So there's potential to damage the opposite side of where the blow happens. So for example, like in this picture here, if you were in a motor vehicle accident that caused you to come forward and hit the front of your head, you may actually also sustain damage in the back region of your brain just due to your brain flopping back and forth in your skull, more or less. Now, it doesn't have to be as exaggerated as this. Like this is a pretty intense example of a coup contra coup injury. It can even happen in less exaggerated movements. We'll move on to the consequences of brain injury. The effects are wide-ranging and vary. No two injuries are the same. Anyone who knows a couple of different people with brain injuries can see this. It really, you can have, man A driving southbound and get struck on the left side of the car, and man B driving southbound getting struck on the left side of the car and get hit in the same place, but their brain injuries are going to be very different. It can result in a variety of cognitive, physical, behavioral, and emotional effects, and it's not always visible. I've heard people refer to themselves as the walking wounded. It can be referred to as the unseen or invisible disability, especially if there's no obvious scarring or physical deformities after a brain injury. Like, for example, if somebody's had a stroke and it is damage just to the brain, it's something that's really hard to see because the person's body looks completely normal. So we'll start with the cognitive effects of acquired brain injury. Memory is a huge one after brain injury. Long-term memory typically stays intact. Short-term memory is what usually suffers after a brain injury, and people have troubles learning new information, learning and retaining new information after brain injury. Attention and concentration is another big one, and when we do cognitive remediation with clients who are just starting their cognitive rehab, we typically focus on attention and concentration first, because if the individual isn't able to attend to something long enough, they're not going to have time to encode it and actually remember it and be able to recall it. This also can impact divided attention. So for example, if you're dealing with a loved one or a client who is maybe tying their shoe and you're trying to have a conversation with them and they get really frustrated, this could signal that they have some issues with divided attention, so they're not able to attend to tying their shoes and having a conversation. We also see slowed information processing speed with individuals with acquired brain injury, and this, may mean they just need a couple extra seconds to kind of digest the information that was presented to them, and then maybe a little bit of extra time to respond as well. The language and communication we already kind of touched on, talking about the Wernicke's and Broca's areas. So when we have somebody who isn't able to express themselves or isn't maybe understanding what is being said to them due to their brain injury. Executive functioning, we talked about a little bit too. We see impairments in judgment. We see people having issues sequencing. So I can give you an example of this. It may even be to the point that somebody can not remember how to make a sandwich unless they have a list written out, right down to the details, like get the sandwich meat and mayo out of the fridge. Perseveration is one that is hard to identify at times, and I know it can be a really frustrating consequence of brain injury for family members especially. And what perseveration means is somebody kind of fixates on one topic or thought, or even sometimes like a repetitive movement, but it most often comes out as focusing on one thought. So for example, if somebody with a brain injury thinks, oh, I need to go to the store to buy a new pair of pajamas, and then all of a sudden that's all they can think about. I need to go to the store to buy the pajamas. I don't want to do this. I need to get the pajamas. I can't do this. I have to get the pajamas. I can't do anything else until I get this pair of pajamas. And that's called perseveration. There can also be sensory and perception issues after brain injury, which can be wide-ranging. I have some folks that have lost their sense of smell due to brain injury. There's a lot of visual deficits that can come from brain injury. After a stroke, there's something called hemi-neglect. Well, it can happen with brain injury as well. It's quite interesting in that a person with hemi-neglect will see their only half of their world, essentially. If you think about, if anybody's ever seen a MOCA test done where they have the clock drawing, somebody who's experiencing hemi-neglect will actually only draw one half of the clock. Or if they're eating their meal, they'll only eat one half of the plate. And part of their rehab and recovery from that is developing how to visual scan, lots of visual scanning. So they make sure that they're taking in their whole environment, not just the one side that their brain is actually still attending to. Some people can also have something called visual agnosia, which can cause troubles functioning in social situations because it can cause somebody to not be able to recognize the faces of people around them. Your brain will compensate though, and for those that have issues recognizing faces, they'll quite often be very good at recognizing voices or articles of clothing. I have had a client in the past with this, and he used to recognize me by the sound my boots made on the floor when I came to spend support time with him, which unfortunately got me the fun nickname of Hitler because of the sound of my boots. He couldn't tell you what my name was if I walked past him in the street, but if I walked past him wearing those boots, he knew who I was. He also wasn't able to recognize himself, which is interesting, and he was very open to talking about this, so I asked him like how that was for him, and he said, well, it makes shaving really hard. And last but not least is diminished insight. I personally find this one the most difficult to support people that don't necessarily have insight into the fact that they have their brain injury. For some, it's great. Ignorance is bliss. And they're like, what? I don't have a brain injury. And they just go on with their merry life and they're happy being supported. But for those that don't recognize that they need the support and don't have insight into the brain injury and their deficits, it can be really frustrating for caregivers and family members, and it can be very difficult to support somebody who doesn't feel like they actually need support. In that case, not all is lost. We find that just working and putting a lot of effort into developing a trusting relationship is, I think, the best way to support those with the diminished insight. I supported a young man a while back who had very little insight into his brain injury, but was willing to work with me. And he ended up with a mental health disorder secondary to his brain injury and was prescribed medication. And he didn't want to take the medication, but our relationship was solid, and I said, you know what, you should just give it a shot. And because we had that trusting relationship, he said, well, I don't think I need them, but I trust you, so I'll take them anyway. So moving on to the physical effects of acquired brain injury. We talked about that little piece in the kind of near the brainstem, the cerebellum. If there's a cerebellar injury, you could see some issues with balance and ataxia. And ataxia is basically just walking, but with more jerky movements. There's not necessarily any smooth, fluid movements happening for somebody who experiences ataxia after a brain injury. Fatigue is huge, both mental and physical. I could probably do an entire slide just on fatigue after brain injury. It typically resolves or mostly resolves after the first 6 months. However, this can be a chronic issue for folks with brain injuries. If you think about the physical fatigue, if the brain injury was due to a motor vehicle accident, maybe there's some actual physical recovery and healing happening, but also healing from the brain. Mental fatigue, I like to think about it as, if you think about your brain as a phone line. So if you think about a neurotypical brain, a brain that doesn't have a brain injury, you know, if they want to call Nanaimo to St. John's and their brain is the phone line, you pick up the phone in Nanaimo and you can call directly to St. John's. It's a direct link. For somebody who's had a brain injury and some of those connections aren't there anymore, they may have to go Nanaimo to Vancouver, Vancouver to Calgary, Calgary to Edmonton, Edmonton to Toronto, Toronto to Deer Lake, Deer Lake to St. John's. So all of that extra wiring can be very tiring. So that's why we see a lot of fatigue after brain injury, which again does let up for some, but not for all, unfortunately. Headaches and chronic pain after brain injury, it kind of makes sense. If you took a blow to the head, you're gonna probably have headaches. Fortunately, not everyone gets these. And then again, chronic pain, especially if it was some kind of traumatic, motor vehicle accident, or something, chronic pain is an issue that we see with folks with acquired brain injury. Speaking and swallowing disorders, so it says dysarthria, dysphagia, those are just two fancy words. The first one means slurred speech. The second one means trouble swallowing. And if you think about the combination of somebody who maybe has some slurred speech paired with some balance issues, paired with maybe some language disorders where they're not making much sense with what they're saying, and you put that person out in community, they are easily mistaken for intoxicated. I've seen that happen with some of our guys who have more severe brain injuries. They will get mistaken for maybe being intoxicated in public just because of the effects of their acquired brain injury. Bladder and bowel issues, that's a fun one. There is something called neurogenic bladder that some folks get, usually with strokes, more than traumatic brain injuries, which just means you feel like you have to pee nonstop all the time. So if you know somebody who's had a stroke that complains that they always feel like they have to pee, there's meds for that. So I would highly recommend they chat with their GP about it. Bowel issues, thankfully, are not as common. But they do happen, some bowel incontinence after brain injury, depending on what part of the brain is damaged. And then vertigo, that sensation that you're spinning, dizziness, can happen after brain injury as well. Not a fun experience. So emotional consequences after acquired brain injury. Agitation and irritability, a short fuse, is common after brain injury, and this is for two reasons. The first, there could be some damage to the actual emotional center of the brain that can cause some dysregulation, some agitation, irritability. A shorter fuse, there could be damage to the brain that maybe has some impulse control, so there's that quick kind of short fuse happening. But it could also be because of the life situation. Having a brain injury and adjusting to their new normal can be incredibly frustrating, and I would have a short fuse if my life changed drastically. Depression and grief after acquired brain injury, again, could be an entire presentation on its own. Again, could be from damage to the emotional centers of the brain, but could also be from just realizing the enormity of the changes in a person's life after brain injury. Perhaps, you're a 50-year-old male who's the breadwinner and has a wife and kids, and then you sustain a brain injury and you can no longer fulfill any of those roles, and now your wife and children have gone to becoming a caregiver for you. That would cause some pretty significant depression. And then also grieving after the acquired brain injury. You have to grieve the life that you lost, the person that you were, and work towards accepting your new normal. And that doesn't happen quickly for some. It can be a drawn out process. It depends on the person and the situation. Anxiety, just like the first two, it can be from damage to the emotional center of the brain, or perhaps there's some new sensory stuff for a person. For some people after brain injury, lights and noisy environments can just cause a sensory overload, which can cause a lot of anxiety. Adjusting to your life after brain injury can cause a lot of anxiety. So there's definitely a couple of different reasons for anxiety after an acquired brain injury. Lability is just a fancy word for mood swings. When somebody has a brain injury, they can fluctuate pretty quickly between happy and laughing to really pissed off quite quickly. And this is from damage to the brain. I also added PLC, which is pathological laughter and crying, which is something I personally just find fascinating, which is not necessarily common after brain injury, but does happen. And I've had a few people in the audience when I've done these UBIs before that was like, oh my gosh, this was a thing for my loved one. So what pathological laughter and crying is after brain injury, somebody could be dealing with a very sad topic, and they're laughing, and on the flip side, somebody could be dealing with a very happy topic and they're crying, and they just have no idea why these complete opposite emotions are coming out of them. But it is actually, there's some pathology behind it from the brain injury. And then lastly, feelings of loss of identity, which kind of ties into the second point of depression and grief after acquired brain injury. your life just gets completely turned upside down after a brain injury. And as I mentioned, some people aren't able to go back to their jobs. Maybe they're not able to drive anymore. They've lost their family role, which can be devastating. Yeah. Behavioral consequences of acquired brain injury. I've got my little Dennis the Menace comic here because it goes along with a lot of what I'm about to talk about. By the time I think about what I'm going to do, I already did it. I've definitely seen this within my work, and that kind of speaks to the disinhibition and impulsivity that can come with acquired brain injury. Engaging in risky behavior can be from just some impacts on impulse control, lack of filter. So for some people after brain injury, if it comes up here, it's coming straight out the mouth without any real forethought. And that is, it can be hard and make people socially awkward. It can make, I know loved ones have a hard time dealing with that lack of filter. And what I try and say to anybody who's struggling with that, especially if lack of filter includes a lot of abusive language or maybe some disrespectful language, is that, you know, having a brain injury isn't an excuse for this behavior. It's actually a neurobiological reason. These people may be missing the part of their brain that controls this. They can learn to reel it in a little bit. It does come with time. Your brain does rewire, but just to have a lot of compassionate understanding there that they don't have a lot of control over what comes out of their mouth. Isolating after brain injury can be huge. Maybe the person has lost motivation, which can come after brain injury. Maybe the individual has insight into the enormity of the changes in their life and doesn't want to socialize and see, you know, friends they used to hang out with because they're now, you know, an incredibly different person and their abilities are a lot different than they used to be. And difficulty with social and work relationships kind of ties into everything else. If you are lacking a filter and you're a bit disinhibited, then that can make social and work relationships incredibly difficult. And the last slide here I added in because I realized the rest of it is, you know, there's some pretty dismal stuff that we touch on. So I wanted to make sure to end this by talking about recovery and how it is possible. There's this kind of notion out there that talks about, you know, the first 2 years is kind of where recovery happens, and after that you're kind of out of luck. But the first 2 years is where the most noticeable recovery happens. It does not end there. Recovery is a lifelong process. We have had clients come to Bill's Place after having their brain injuries for 15 plus years. You put them in an environment that has, like a positive environment that has, you know, the right amount of stimulation and new experiences and, you know, good food and somebody taking care of their medical needs. And we see people make gains even 15, 20 years past their brain injury. We also have this wonderful neuroplasticity that is proof that the brain can reorganize itself throughout life. There used to be this thought that once you know, hit adulthood, that was it. That's not true. The brain, even a damaged brain, can rewire itself and, you know, compensate for any deficits that there are. So recovery is possible. And that wraps it up. Here's some contact info for Adrienne. If you want to get a hold of her.
You can get a hold of me. I am in the office. We are still here. I'm just gonna stop this so we can have a better chat. Thank you very much. That was awesome. I just normally we would be taking a break and letting everyone have a snack or something, but we're just gonna keep going here. So if you need to take a break, do so and come back. We just have some questions that have come up. So some of them are just common questions that people who have come here have asked, and a few of them are from emails and Facebook. So one of the questions that kind of relates to what you were just talking about is when you've just had an injury, the question is, will I ever fully recover?
Mhm.
You were just kind of touching on that a bit.
Yeah, I mean, there's potential for recovery. It's different for every person depending on their brain injury, of what recovery looks like. Some people can get very, very close to their baseline. It depends really on the severity of the injury, and even a person's recovery depends on a lot of different factors. Their health prior to their brain injury, even things like their socioeconomic status can impact recovery. So if they have money to pay for private services, because the unfortunate reality is there aren't a lot of publicly funded services for people. There are some, but if you have a good source of income or funding, there's just a lot more available. That's just the brutal truth of it all. So I can't just blanket answer, will I ever fully recover? There are some people that will. They would regain, maybe get their license back, return back to their jobs, and maybe still notice that there are things that aren't quite right, and they're still maybe noticing impacts of their brain injury. But there is always a possibility of recovery. And the more you put into your recovery, the more you're going to get out of your recovery.
Awesome. And then this next question actually kind of touches on what you said as well. Why am I tired all the time? So you said you could probably do a whole slide on fatigue and
Yeah, absolutely. So another analogy that people use is like a battery pack. So people who are neurotypical go to bed at night, they get a good night's sleep, they wake up, they're at 100%, they go about their day. But for people with brain injuries, they may only, they may go to bed at night, not necessarily sleep incredibly well. Or maybe they do, but they wake up and they're still only at about 50%. So they're starting with less energy than people without brain injuries. So they're if they're starting at 50%, and by halfway through the day you're getting pretty low on your energy reserves. So I always encourage people with brain injuries that if they're tired, listen to your body and take breaks. Nap if you have to.
no need.
I see people with Monster energy drinks and I tell them, no. Just listen to your body. If you're tired, take rest if you can. Yeah, have a cup of coffee, sure, but not the energy drinks.
Energy drinks.
That's my PSA for the day.
Is it normal to feel angry more often? So you did touch on that, and that depending, I guess, on where you are in your recovery, but
Yeah, absolutely. And again, if you had some damage to the emotional center of your brain, or the part that controls the impulsivity, maybe you have a shorter fuse from your brain injury that is common. Or maybe you're just pissed off because your life is so different and you're having to go through this whole process that is completely unfair.
mm-hmm. We have another one here. Are there any things that I can do to help me recover more quickly?
Absolutely. Eat well, get as much sleep as you need, listen to your body, and make sure you're in a good, positive environment. And what I mean by that is if you have sustained a brain injury and you're in a toxic relationship, going back to that toxic relationship and enduring a lot of stress is not going to help with your recovery. It's going to do the exact opposite. It's going to cause problems with your recovery because the stress will impact your recovery. Yeah, just the things that everyone does to stay well: eating properly, making sure you get enough sleep, drinking enough water, getting daily exercise activity, that in itself also helps with neuroplasticity. Yeah, there's plenty of studies to show how important exercise is to help with brain function and neuroplasticity.
Awesome. Do you have any suggestions for online websites, games, or apps that can help? I know people have asked a lot of questions about, if you do Sudokus, or
Yeah,
if you're online playing those games.
all of that. Anything you can do to challenge your brain is great. People use Lumosity, which is decent. There's one, Brain HQ, that I know some OTs that I've worked with have recommended. But really, anything you do, like functional recovery, is just as good as the pen and paper and online stuff. Challenge your brain to do different things. Even brushing your teeth with the opposite hand will challenge your brain. So do new things, but make sure it has the appropriate level of challenge. If you're doing something that's too hard, then it's just going to cause frustration. So just finding those things that have the appropriate level of challenge. Do the Sudokus and the crosswords, and if that's what you like. If that's not what you like, find something that you do like and do it. That's going to challenge your brain.
Yeah, I've definitely heard of what works for some doesn't work for others. I've had one person say, "Oh, I really love, those coloring books and adult coloring," and another woman was like, "Nope, if I color outside of the lines, I get super angry." So
yeah, well, for some it's like, I'm gonna go teach myself how to build a birdhouse. Awesome. If that's what you love doing, do it. Just keep your brain active and challenge it to the right amount. Don't make it so easy where you're like, I'm flying through this, but don't make it so challenging that you're frustrated and don't want to do it anymore. Yeah.
Okay. Is it normal to have problems with lights, sounds, and movement?
Absolutely. The lights and sounds, noisy, crowded environments, it's a lot of sensory input that people after brain injury can be sensitive to. The best thing there is just to develop insight and work on recognizing when you're becoming overwhelmed. So for example, if you're wanting to go to Tim Hortons for a coffee, and that crowded environments are overwhelming and anxiety provoking, maybe think about what time of day you're going to go. Maybe go during not the peak times for Tim Hortons. And the movement as well. So that's more, that's visual processing, which can be hard. People can actually get nauseous and dizzy just from people walking past them. Definitely common after brain injury. Yep.
All right. Why can I do complicated things very well, but other simple things can be difficult?
I would bet that this question is more about new simple things, would be my guess. So again, that long-term memory piece would stay intact. So my guess would be that this question came from somebody who could do complex things that they did prior to their brain injury, and they're struggling with how to do new simple things. But that's all to do with memory, attention and concentration, and being able to learn new skills. That'd be my guess. I'm not 100% sure about that question, but
another question that we get or have been getting a lot in the past probably 18 months is the question around now that medical marijuana is legal, the question just around CBD and THC and kind of what your thoughts are on that for people who've had a brain injury.
Yeah, my advice is always use with caution. It's, if you're using it for medication, it's like any other medication out there. It's going to work for some people. It's not for others. I would say if it works for you, great. I would strongly caution the THC components of it, just because people with brain injuries metabolize drugs a little bit differently, and the THC can and has been known to cause psychosis in people with brain injuries. So I would definitely urge caution there. As far as CBD goes, yeah, it's like any other medication, right? If it works for you, that's fantastic. And if you're finding relief from your symptoms, wonderful. But it may not be the be all end all for you just because it was for your neighbor. Yeah.
Awesome. All right. Well, that's a wrap for us tonight. We'll be doing another one in another 2 months, and maybe we'll do that one live so we can have some people asking some questions. But I just wanted to say thank you to Ashleigh. It is currently National Volunteer Week, and she is an NBIS volunteer, and she's here doing this for everyone because that's how much she loves it. So I just want to say thank you to you.
You're welcome.
And we will see you on the next Understanding Brain Injury.
Awesome.
Bye.
Bye.